Welcome to another episode of Bite Back.
Teeth are the easy part. Now, being a woman in dentistry, that's where things get interesting.
Now, in today's episode, we've got the fabulous Dr. Julie Pham, who has become a mother, and we've invited you to talk about your journey with motherhood and just how you navigate that in dentistry as well.
Awesome. Thanks for having me, guys.
It's good to have you.
This is my first podcast, so
I love it.
This might be my one and done, depending on how well
One
it goes.
of many.
This will propel you into a stardom career of podcasting.
Stop. Okay, yes.
So tell us, you've got a nearly one?
Yeah. So I had my baby girl. She is now 13 months. I always thought that I wanted to be a mum, and I have two dogs, being dog mums. And I didn't think I would be able to love anything as much as I loved my dogs. But once you have your child, it really does change your perspective on a lot of things.
Let's talk a little bit about how you're navigating it with your career as well, motherhood and career. So you're doing so much. You're doing courses now.
Back at work as well.
I know. I'm seeing on Instagram. I'm like, this girl is like boss lady. I'm like,
Guys,
good on you.
Look, I think every day is a balance, and like anything you see online, and you think that everyone's so put together and whatnot, it is just a little snapshot of my day. I would say that since becoming a mum, it has really changed my perspective on a lot of things, and I've really learned to prioritise and time management a little bit better, be a bit more efficient, and I feel like I'm finally coming to a point where I feel a lot more confident in what I'm doing and feeling more ready and encouraged to share that. It's not that every day. Every day is a little bit different, and it's just about finding time to be able to do the things that you really love.
Yeah, and that's really important. Like if you do love it, then you go, okay, you know what? I'll give a little bit more here. Like I'm okay to give it here.
Yeah,
and that's what's just finding your passion. It seems like you've really found your passion.
Thank you.
Yeah,
thank you.
You found your little groove as well.
Thank you.
I know. I love it. I love seeing it because I'm like, I want kids in the future. I'm like, okay, it's all right. Julie can do it. I can do it. And I'm sure there's a lot of mothers. Yeah. There's a lot of, women that are looking at starting a family and they're probably really scared about it. If there's I know it's hard to say one piece of advice, but what is one thing that you would give to an expecting mother or somebody that's wanting to, especially the dentistry field?
Look, I think anyone who has gone to dentistry, they're high achievers and they have a lot of expectations on themselves, whether they work in a general practice, in the public sector, or in a cosmetic practice like us. A lot of women, especially in dentistry, because it is such a skill-first job, that taking an extended period of time, whether it be for motherhood or to travel or just to do any side quest, is scary. I think for myself, when I had my baby, it was the best thing ever, but it also was at least the first eight weeks when you're not sleeping, you've got a child that you're fully responsible for. It is really scary, and you go through a bit of an identity crisis where you don't know who exactly you are anymore, who you are as, a mother, a partner, a friend, or even just as a dentist. So I feel like it's so nice that you say all these things, because I feel like I've really come through the other end now where things, they aren't overwhelming, but I just have less expectations on myself. And because I don't stress myself over things anymore, it just becomes a little bit easier.
Okay,
Not that
take home tip 1,
right.
Don't stress over the little things.
Right.
I love that. It's actually so true. Like even, not being mothers, but just I feel like we stress about every little thing. We lose sleep over every little thing when it's really probably not even.
I think important. I read somewhere that it's the extra estrogen that we have that we just end up. It's wired in your brain to always multitask, whereas I'm not at the risk of sounding sexist. But men are singular focused, and it's not to say one is worse than the others, but I do know that it is quite a universal experience that women do get hung up on things and they rethink every single interaction and everything that they've done throughout the day, and it's easy to be hypercritical of yourself.
And you know what? It probably takes, that's the best, like with men, they don't have to think about that, and they probably have more time in their day because they don't spend 2 hours thinking about, oh, I shouldn't have done that, or if I did this differently, they get an extra 2 hours that we probably don't even have. And it's true, like we do hyper focus on everything. Makes us great dentists, don't get me wrong.
What did you feel like was like the biggest challenge for you? So going through that, emotional period of no sleep for 8 weeks, and then you have to think, oh my God, I've got to go back to work at some point. What was the most challenging thing, and how did you overcome it, and have you overcome it yet?
For me, every day is a work in progress. I don't have everything together. It may look like I do, but every day I'm just trying to be the best version of myself as a mum, as a dentist. When I found out that I was going to have my baby, I was really excited. I had my baby a little bit later in my career, so I felt like I had achieved a lot of things that I really wanted to do. There's no real perfect time to have a baby or to start a family, right? But for me, I didn't have anything professionally that I felt like I really needed to do. Not to say that there aren't things that I still want to achieve moving forward. But for me, I felt like I was ready professionally. I am really lucky to work within a clinic with so many supportive colleagues that I knew from the patient perspective that me taking an extended leave, no one was going to be without good care. I felt really comfortable that anyone who had seen me, they would get exceptional care with any of my colleagues. So from that perspective, I felt really reassured.
It's actually reassuring for us to hear that as well, because that's one of those things that you stress about. Like, oh my God, if I have to take all this time off, what's going to happen to all these people that I've started treatment on, or that are midway, or that just need reviews as well.
And the thing is, like, I am so particular about everything that I do.
I think the three of us are. Yeah.
Right?
I think we're the most OCD.
Yeah, and like I'm the most hypercritical person of everything. But I think this is like lesson 2 is that you have to be okay with delegating, and you have to be okay with...
It's like letting go a little bit.
Right?
As well. Yeah.
Because somebody else will still be able to do what you do. They may not do it exactly the way that you will do it, but it doesn't necessarily mean it's right or wrong. I mean, we're quite lucky that everyone that we work with, the standard is really high within Dental Boutique. And so for me, that was one of the most reassuring things, was that I could take some time off and not worry about any outstanding work that needed to be done or any of my patients that needed ongoing care. Yeah. So
now that you've come back, and you've reviewed these patients, how are they all going?
So nobody had any issues, and if they did, I was like readily available to help anyway. I having a baby, but I'm not still able to do things.
You're not like where your cell's like not, your phone's like not reachable. You're at home.
I mean, like in the first 8 weeks, I felt like throwing my phone out the window. For me, it was a good time in my career to do something different. I wasn't worried about my patients because I knew that they would all be in great care. Being a mum, especially a first-time mum, it is quite hard, especially, and I think both of you may relate to this, being that we are such not high achievers, but we are high achievers, and we have a very high expectation of ourselves and a high standard that we keep. It is really, really hard, especially when you're going through your postpartum period. There is a huge hormone imbalance, and just everything is new and scary. So I found that for myself in particular, navigating that first 8 weeks was really particularly hard. And upon reflection, I think that it may not have been that hard because I have a very easy baby, but I'm just so critical of everything that I do. So when I compare myself to a lot of the mums that are in my mother's groups, a lot of the mums who are a little bit more easygoing, who would go with the flow, they found that first 8 weeks a lot easier. So if I could give anyone any piece of advice, is like, just don't have any expectations. Just go with the flow. The clock is just there as a guide. If you stress too much about the time, how much your baby eats, how much your baby sleeps, like you're never going to have that chance to really enjoy that moment. And when you're enjoying that moment, you start to flourish because you start to remember who you are and you're not stressing so much about the little things.
Can I just say though, I feel like this has summed up what we've been talking about the past episodes as well. Just even in dentistry, like not worrying about the clock, not worrying about the speed. It's just quality, spending quality time with your baby, spending quality time with your patients. Like that's what it's, I think that's the moral of the story.
Just enjoying the process and enjoying the journey.
100%.
Well.
And for me, like I'm really, really lucky in the sense that I've never been pressured into, going back full time or going back earlier. I was able to come back at the time that I felt comfortable. And as a result, I've been able to increase my days and increase, additional things that I do outside, such as teaching and mentoring. And that has all been on my terms. And that has made the decision a lot easier.
Tell us a little bit about the teaching. So you're teaching?
Yes.
Yes.
So I've been teaching probably for the last 3 years. It's funny because I kind of just sort of fell into it. It was supposed to be like a little special guest, and then I just never left. and next thing you know, they gave me the title lead lecturer and whatnot. Wow. And sometimes I think about it and I feel like I've got imposter. I don't know if we all do this, feeling like you've got imposter syndrome. And like, why does anybody want to listen to me like a little cutie? But
like, who am I to tell people what to do?
Right?
Yeah. I think females have it more than men.
I really think we do
from
a lot.
Working with our male colleagues.
Yeah.
They just
fearless.
They just do it. They're fearless. I call them cowboys. They just go for it. Where I think women sit there and think too much sometimes, and it's like, we can do it as well.
And I think that for me, like having that balance of, when I'm with my baby, I'm mum, but when I'm outside of that, I have my little alter ego of being like a boss woman at work, being a boss woman outside of work, allowing myself to accept that I am good at my job, and not deflecting when I get compliments. I'm still working on it because I don't like getting compliments, and I find it hard to sort of just accept it. But it is so nice because it reminds you and centers you that you are still your own person. You can still have a career. You can still have goals outside of being a mum, and that's okay. I remember reading something that, one of the things that worried me about going back to work, especially increasing my hours, is that what if that adversely affect my baby's emotional well-being, and just her view of me as a mother and how present I was with her. And I read somewhere that kids of working mums didn't have any adverse effect on their emotional well-being, didn't, feel neglected when the mother did spend time with the child, that they were present, and they were in a happy, healthy household. So I think I read a study somewhere that kids of working mums are more likely to be employed, they're more likely to take positions of leadership, and they're more likely to be in jobs that are high earning. I feel like when I sort of accepted that, it made me feel okay to do so, that it was okay for me to achieve my goals and have ambition because I was modelling to my baby that it's okay to do that. And not to worry about
she has
things.
Someone nice to look up to as well, so it's almost like admirable as well.
Well, my mum worked full time when I was going. Same.
Look
at her. Hey, we are fine.
Yeah, right.
We are great.
Right. My mum went back to work, I think, at like 2 weeks or something like that.
Look at us go.
Yeah.
I think we're fine.
Is mum Julie and work Julie a different persona, or have you intertwined them?
Yeah, I think that as a person, I've always been quite empathetic, and people who gravitate to this kind of work will tend to be that way, right? Because you care for the patients. What I think I really needed to improve on was remembering that empathy doesn't necessarily mean taking all that home with you. A lot of times you'll do work, and because the type of work that we do is quite transformative, there is a huge emotional element of that. And sometimes I would take that home and let that affect myself too much in my after-hour times. So since being a mum, although I am still empathetic, I'm still like there for patients and whatnot, I'm prioritising my time outside of that and not letting those things affect me so that I can be present for my baby when I get home.
We are so grateful to have the amazing Dr. Julie Pham on today. If anybody would like to come onto the podcast and have a chat with us, please let us know. Send us a message. We'd love to hear your story as well.
And as always, scrubs on, doubts off. We'll see you in the next episode.